It's that time of year again. Plans are finally available to preview for the Medicare Advantage AEP for 2025, so let's dive in. Now, if you're new to Medicare Advantage, I'm going to give you a super brief rundown just so you understand the pros and cons before making this very important decision. So Medicare Advantage plans are actually an alternative to Original Medicare. That means you can't have Original Medicare and Medicare Advantage together. They must offer at least the same benefits, but very often they choose to offer additional benefits to entice beneficiaries. Most frequently, these would be things like dental, vision, hearing, and prescription drugs. But as I said, they must offer at least the same benefits as Medicare Part A and Medicare Part E. Now, all this may sound great, and sometimes it is, but there are some downsides to Medicare Advantage that you need to be aware of. For example, there's the issue of restrictive networks, which can sometimes leave a vulnerable population having to travel extensive distances to receive medical care. Then there is the major issue of pre-authorization, meaning that if your doctor recommends a specific service or treatment, your insurance carrier must first approve it as well. This can sometimes lead to delays of major medical treatment or even denials. Now, in addition to this, as of late, there have been many disputes and many dropped Medicare Advantage plans because doctors, providers, hospitals are very frustrated with the issues of pre-authorization and also very frustrated with payment issues. Unfortunately, sometimes people sign up for a Medicare Advantage plan and then halfway through the year, their provider drops the plan, leaving them with little alternative. But on the flip side, very often there are those additional benefits which can offer significant cost savings. And very often these plans are actually offered at no additional cost. You simply need to continue to pay for your Part B monthly premium. We're going to see that in just a moment. A brief pause here to remind you to like and subscribe to stay up to date. Also, if you have questions about your healthcare, Medicare, you can reach us in the comments below or at the number on the screen. We are licensed health insurance brokers, we're licensed nationwide, and there's absolutely no charge for our services. All right, let's get back to it. Okay, plans are available to preview for 2025. So do we think the plans are going to be better, worse, about the same? What do you think? 2025, I'm going to put in a North Carolina zip code just because in Florida, the Medicare Advantage plans tend to be a cut above the rest for the rest of the country. So let's try to make things a little bit more even. So we're going to look for Medicare Advantage plans. It's going to ask if you get help with your Medicare, health, or drug costs. So if you have Medicaid, that means you're dually eligible, so you could look into a DSNP. We've got a video coming out all about DSNP, so I highly encourage you to subscribe to stay up to date. Also, it'll ask if you get help from Supplemental Security Income, Medicare Savings Program, or extra help. That is really for Part D drug plans. We're going to put I don't get help from any of these programs. Do you want to see your drug costs? If you take prescription drugs, absolutely. All right, let's put in some prescription drugs. I feel like I often add the same drugs. All right, let's add another drug. I actually just made a Part D video, so we had to add a lot of prescription drugs so that way we could get some accurate information. Do I want to add the generic or keep the brand? Let's keep the brand just in case. Add to my drug list. Let's add another one. Do generic, add to drug list, and another drug. Oh, I added, let's see. Honestly, I could just do whichever ones they recommend because this is just for comparison's sake. Add to my drug list. Anything else that we want to add? Is this all right for right now? I feel like that's fine. Let's say we're done adding drugs. Okay, now it's going to show some pharmacies. I recommend that you click a mail order pharmacy to compare. Very often you'll notice that that mail order pharmacy is less expensive, although that's not always the case. And sometimes it's such a negligible difference that it's still more convenient to go to the brick and mortar. Walgreens, Harris Teeter, Hawthorne Drugs. I don't know what that is. Let's do CVS. Okay. Done. Now let's see what's available. So we've got 57 Medicare Advantage plans available. And right now it's filtering by lowest drug plus premium cost. So that is because it's taking into consideration the extensive list of prescription drugs that we put in. And I'm going to guess, based on this total drug and premium cost, that a lot of these are not covered. Let's see, total drug and premium cost. Yeah, that's probably the case because if you can see, this plan has a $0 monthly premium, but our total drug cost for the year is $7,492.06. And those Part D prescription drugs are really capped at $2,000. So definitely a lot of these prescription drugs are not covered by these plans. But let's take a look anyway. All right. Let's see some of the benefits. This offers a rather extensive list of benefits. Okay, so here's some of the things that you want to look at. Of course, one of the most difficult things to compare is the network, which is so important when it comes to Medicare Advantage plans, because if you do have to go out of network for a PPO plan, it's going to be more expensive. And if you have to go out of network for an HMO, unless it's a true medical emergency, then you have to pay the full extent of the bill. So it's still showing the $174.70 premium, which you would have to pay on top of your monthly premium. We're still waiting for those Part B premiums for 2025 to be released. It's estimated that it's probably going to be somewhere around $185, but we don't have that info yet. We'll make sure to keep you posted once we do. Anyway, let's look at the plan details for this plan. So this is our monthly premium in addition to whatever the Part B monthly premium is going to be. And here is the health deductible. And your primary care, your PCP, is $0 copay. This is an HMO. That means that you need to have a PCP. It covers 3 of the 4 drugs, and that's where this large number is coming from. So we'll check that out in just a moment. Scroll down. Health deductible. So this does not have a deductible at all for your health, your medical coverage. It also doesn't have a deductible for your prescription drugs. Sometimes there can be a health deductible, but no drug or vice versa. Now, here is your out-of-pocket maximum. Now, because this is an HMO, you only have in-network covered. You can pay a maximum of $3,150, not including your premium, of course, for covered in-network services. If you go out of network, except in the case of a medical emergency, that doesn't count towards your out-of-pocket maximum. If it's a service that is not covered, it doesn't count towards your out-of-pocket maximum. Let's scroll down. Benefits and costs. So if you go to your PCP, $0 copay. Specialist, $20. Here's some of the costs for basic tests, labs, and imaging, somewhere between 0 to 25, 0 to 5, 0 to 300, or 20% coinsurance. You're going to see everywhere that it says limits apply. That is because Medicare Advantage plans are managed care plans. That means you must have pre-authorization for any of these services. Continue on down. $0 to $15 copay, emergency care, so if you go to the ER, $135, and urgent care, $55 copay. Here are your inpatient and outpatient copays and coinsurance. So in-network, $335 for days 1 through 5, $0 for days 6 through 90, $0 per day for days 91 and beyond. And outpatient, it's $335 copay per visit. Skilled nursing facility, also very important. Although you don't have a copay after 6 days, it's highly unlikely that a hospital is going to keep you there unless you actually continue to need inpatient care. So if you did need to recover from something like, let's say, a knee surgery, then it's likely that you might end up in a skilled nursing facility. Now, in-network, $0 for days 1 through 20, and then $214 for days 21 through 60. Yikes, that's starting to get expensive. And for something like a knee replacement, I believe the recovery time is somewhere between 6 to 12 weeks. Now, that's not to say you're guaranteed to have to stay in a skilled nursing facility that long, but days 1 through 20, that's only 3 weeks. So if you needed more than 3 weeks of coverage, then it's getting pretty pricey. Preventative services, that's going to be a $0 copay. An ambulance, if it's in network, and that's always so tricky with ambulances, it's $250. Here's your copay for additional therapy services and drugs. So this is why we were seeing some of those very expensive costs, and I have a feeling it's probably for the Lipitor. Every time I put in Lipitor as an example, it's always the Lipitor that drives up the costs. We'll see that in just a moment. So all of the pharmacies that I listed are actually in-network. However, if you see a green check mark and it says preferred, that means that generally speaking, the copays or coinsurance at those pharmacies are going to be lower than just a regular old in-network pharmacy. So if you can, if it's convenient and available to you, try to go for a preferred in-network pharmacy. And now we're going to see the breakdown, and this is why it's so expensive. So, or actually both of these, I guess. Does it show our tiers here? Probably see that in a moment. Yeah, here. Okay. So just like Part D plans, Medicare Advantage plans, if they offer prescription drug coverage, have tiers. Tiers for Medicare Advantage plans and for Part D plans vary tremendously from plan to plan, not just, of course, what the copay or coinsurance would be, but even how they break it down. So this plan is broken down as preferred generic, generic, preferred brand, non-preferred drug, specialty tier, and select care drugs. Okay, so this one has select care drugs, which is kind of very similar to preferred generic. Usually those are going to be your least expensive drugs. Those are like the most basic drugs, for lack of a better term. It's just sort of confusing because sometimes when they number the tiers, this would be like a tier 6. And usually it's those lower tier medications that are less expensive, except when you have those select care drugs. So let's see. So this is a tier 2 medication. So $6 copay. This is a tier 1 medication, $0 copay. This is tier 4. What's tier 4 on this? Non-preferred drug. Oh, it's $99 copay. And then this one isn't covered, which is why it's thousands of dollars. This is very frustrating. It's always a recommendation to take generic whenever possible, but there are people and sometimes instances with medications that even though the generic is supposed to be the same, sometimes for certain people it just doesn't work the same. So obviously the best recommendation is to try to find a plan that covers your brand of medication. And if it doesn't, then you may need to look into something like GoodRx or state pharmaceutical assistance programs. Some states offer basically discount drug cards, Florida. And then even for some of those more expensive brand name medications, there are prescription assistance programs. And sometimes basically the brand, the prescription itself, will offer some type of financial assistance. So let's scroll. That being said, now that we've looked at that, let's scroll back on up. Okay, here are the yearly costs. That's why they're so high. Which is our least expensive for this? It's going to be one of those preferred ones. Oh, it's the mail order pharmacy. Okay, here's the Medicare prescription payment plan. So this is something that is new for 2025, which is that now actually when you go to pay for your prescriptions, you don't have to pay the entire thing in one lump sum. So for something like a very expensive Lipitor, you can actually spread it out over the course of the month. So that would certainly be very helpful to people with more expensive prescription drugs. Okay. Other drugs, these are considered Part B drugs. So these are the drugs that would not be covered under Part D. These are things like chemotherapy, anti-cancer medications, vaccinations that you receive in the doctor's office, and insulin if it's administered via pump, amongst others. So for Part B insulin, $35. That's because Part B insulin and Part D insulin is capped at a $35 copay for a 1 month supply. Chemotherapy, 0 to 20%. Coinsurance, that's such a struggle because it's a very big difference when you're talking about medications that cost thousands of dollars. 20% versus 5% is a huge difference. And other Part B drugs, it's the same. So this plan does offer hearing benefits, fitting and evaluation, prescription hearing aids as well. Remember that hearing aids are now available over the counter. And even though this plan does offer prescription hearing aids, those hearing aids that are offered over the counter are still less expensive, even with some type of coverage. It does offer dental. That being said, remember that if you are going to go with a Medicare Advantage plan and it does offer dental, then those dental benefits and networks may be restrictive as well. And if you're somebody that has a specific dentist that you already see, they may not accept your plan. Vision services are covered. Let's look at some of the extra benefits. So no chiropractic or acupuncture, massage therapy, almost never covered. What a shame. We scroll down, so here are some of the additional benefits that are covered. I would caution you, one of the very appealing things about Medicare Advantage plans are all these additional benefits. However, these aren't really the important benefits. That's why we call them extra benefits. These are the important benefits. These are the things that are really expensive. These are the things that you may 100% need. Those extra benefits, while great, the Silver Sneakers program, wonderful, they're not necessarily the things that you 100% need. If you need to have heart surgery, then that is going to be a lot more expensive. Please make sure that the basic benefits are in line with your needs. So let's continue to scroll down. This is a PPO plan. So a PPO is going to give you way more flexibility because you don't need a PCP, primary care physician, and you don't need specialists to see referrals. And of course, if you do need to go out of network, then you can. You will see that there are separate out-of-pocket maximums for in and out of network, although in this case, it is actually the same. And you will see, of course, this includes drug coverage, and here's a snapshot of the benefits offered. Now, if you want to, you can filter by certain things. So, for example, you can filter by whether it is a PPO. We had 57 plans before. Now we have 29 plans, so about half are PPOs, half are HMOs. You can also filter to make sure that it includes prescription drug coverage. And please, you do want to have some type of prescription drug coverage. It is important. Even if you found the perfect Medicare Advantage plan that just is perfect for you in every way and it doesn't offer prescription drug coverage, then there are Part D plans that actually have no monthly premium or very, very low monthly premiums. So please make sure you have some type of prescription drug coverage in place. You never know what the future will bring and if you are going to need some type of prescription drug coverage. And then there's also that Part D late enrollment penalty that you absolutely do not need to be subject to. So now we've made sure that we have a PPO with drug coverage. So now we're down to 20 plans. You can also filter by insurance carrier. This is very important with Medicare Advantage plans because these are offered by private carriers. And unlike Medicare supplement plans, the carrier is very, very important because we're talking about the network here. Now, if your doctor, for whatever reason, only accepts Humana, then you need to make sure that you're on a Humana plan if you need to continue to see this doctor. Let's see. And now we're down to 7 plans. So this one has 2 separate deductibles. It's got a $400 annual health deductible and a $450 drug deductible. A $14,000 in and out of network, out of pocket maximum. Wow, that's pretty high. And that's one of our better options based on the drug information that we put in. And I am going to go back to the drugs and pharmacies because I know that this Lipitor thing is really throwing us off. So let's get rid of that. Down to adding drugs. We'll keep the same pharmacies. Oh, this is not a good plan for us based on the premium and drug cost. I would certainly hope if you had to take these medications that these weren't all the criteria that you would have to meet. But there's plenty of plans that have a $0 monthly premium, at least, even though those drug costs are still rather significant. Okay, let's get rid of that Humana filter. Now that we've gotten rid of that, even with those additional prescription drugs, our costs have gone down significantly. So this has got a $25 monthly premium in addition to that Part B monthly premium. This one has no monthly premium. So let's compare a few of these plans. I'm going to get rid of the PPO filter also. Also, FYI, of course, you can sort just by monthly premium, by lowest health deductible or also lowest drug deductible. This is just sort of the easiest snapshot. So let's compare a couple of these plans. Let's compare this one. And let's do a $0 monthly premium one. As you can see, there are a lot of $0 monthly premiums, but they are not free. Don't let them fool you. So when you do this, basically it's showing you a lot of the information that I looked at with you just now, but it is truncated so that way you can see each of these on the same page. So we've got Blue Medicare Enhanced HMO, Blue Medicare Choice, and Devoted Choice North Carolina PPO. You scroll down. Each of these have a $0 health deductible. This has no drug deductible, $375, $590. Here are your out-of-pocket maximums, $3,150, $2,800, and then $5,550 for in and out of network versus $4,600 for in network. So, I mean, obviously these out-of-pocket maximums are higher, but they're certainly still within the realm of reason, especially because this is a PPO plan. Drug premium, $4.50. I guess it breaks it down. Oh, it does. Yeah. So your health premium is $14.50 and your drug premium is $4.50, which brings you to your total premium of $19, whereas these plans don't have a monthly premium. Then there's that Part B premium as well, which is still really TBD. Plan features. Here's a quick snapshot. Now, if you want to click additional benefits, that would take us to a different page. Medicare Advantage plans are famous for all of the additional benefits that they offer that are not offered by original Medicare, like vision, dental, hearing, transportation, fitness, etc. Really, all of these and many more. And annual physical exams. We actually just did a video about that. Your PCP or primary care physician, $0, $0, $0. Specialist, $20, $15, $25, and $0 to $25, depending. Here's costs for all of those lab procedures. Inpatient care, $335 for days 1 through 5, and then 0 and 0. $295 for days 1 through 5, and then 0 and 0. $325 for days 1 through 6, and 0, 0. Outpatient care, these are all pretty comparable. And you're going to see that quite a bit. You know, as long as the plan that you're interested in isn't like a major outlier for some reason, they're going to be pretty comparable in these costs. You'll notice a difference in the monthly premiums, but again, those aren't even usually that significant with Medicare Advantage plans because so many are offered with no additional monthly premium. You may notice different deductibles, and then a very big difference could be your out-of-pocket maximum. Here's some additional benefits. These all offer dental in some way. Preventative dental, but restorative services not covered. Facial surgery not covered. Yeah, this plan didn't have necessarily, both of these didn't have all the fringe benefits that this one did. 20% coinsurance for durable medical equipment. All right, here's those drugs again. 3 of 3 prescription drugs. This one only covered 2 of the 3 prescription drugs, so probably not the best plan for us unless you were able to get that 3rd prescription drug covered at a comparable amount with some type of GoodRx or state pharmaceutical assistance program or pharmaceutical assistance program based on your income. So let's see, $1,300. Oh, much more expensive. Yeah, yikes. That's because one of the prescriptions we put in is not covered. Now, these are just brief snapshots. As you notice, when you click on the plan details like we were looking at before, it goes much, much more in depth. One more thing to look at. If you are eligible for a DSNP because you are eligible for Medicaid and Medicare, then you will see that on the right-hand side of the screen. Over here, you would click Have both Medicare and Medicaid, and then you would be able to see all of the DSNPs available to you. So if you are going to enroll in a Medicare Advantage plan, then you can do so either during your initial enrollment period, which is the 3 months before you turn 65, the month of your 65th birthday, and the 3 months thereafter, or during the AEP, which is every year from October 15th to December 7th. If you change your mind, Medicare Advantage isn't for you, or you just want to switch plans, then you can do so during the Medicare Advantage open enrollment, which is January 1st to March 31st. And one final set of dates to throw at you. If you are within your first year of enrolling in a Medicare Advantage plan, you're still in that trial right period. So if you want to drop it and make the switch back to original Medicare, you can do so with ease. If you are going to enroll in a Medicare Advantage plan, you can do so in one of 3 ways. First of which is to use Medicare.gov, which is the website that we just looked at. Your second option is to contact an agent directly. This can be helpful with Medicare Advantage plans because they're offered by private carriers. However, remember, if you do work with an agent, they're a representative of the carrier, which means they can really only discuss with you the plans offered by that particular carrier. And then your last option is to work with a broker. A broker works for you as opposed to the insurance carrier, meaning they can discuss with you a variety of different plans offered by a variety of different carriers. And of course, at iHealth Brokers, we are health insurance brokers. So if you have questions, you can reach us at the comments below or at the number on the screen. We're licensed nationwide. There's no charge for our services. Of course, please make sure to like and subscribe to stay up to date. And if you're still on the fence between Medicare Advantage or Original Medicare and Medigap, I would highly recommend you check out this video below, and if you want to learn more about Medicare in general, there's a Medicare playlist there as well. Thanks for watching, and we'll see you next time.